Year, millions of Americans suffer from mental illness, but the good news is there is help and ways to treat the illnesses. Dr. Amador and Joshua Bell are here to tell us more. Good morning to you both, gentlemen. So, Dr. Amador, let's start right away with treatments. What kind of options are there for Americans?
Well, first, the real foundational treatment is antipsychotic medication. It is effective in about 75–80% of people with the illness. Today, we have many more options than ever before, and that's really important because not everybody responds to every medication. You got to find the one that's right for you. Among the innovations we have for many years now is taking medication just once a month so that you don't forget it. If you don't believe you're ill, which is one of the symptoms of schizophrenia and bipolar disorder, where your brain essentially tricks you into thinking everything's okay, those once-a-month medications are incredibly useful and have research shows and my clinical experience show make a huge difference in terms of allowing people to recover and return to life.
And Joshua, what is your experience with mental illness?
I've been diagnosed for about 13 years now. And it has helped me a lot to be able to transition from taking pills for medication to the once-a-month injection. One of the best benefits is that my family doesn't have to worry, have I been taking my medicine? You know, they know they have that security that yes, I do have my medicine in me. And the treatment is very convenient. You know, only going in once a month rather than having to remember every day. But you know, for a long time I took pills, and there's nothing wrong with that. That works too for a lot of individuals. It's a struggle to find a combination that works. You know, and I'm by no means an expert, but I know for me, in my case, that it took a lot of trial and error to find something that actually worked.
Of course. Dr. Amador, you mentioned earlier that denial takes a large part of not getting help for the symptoms. What should loved ones look out for when it comes to diagnosing something?
Well, understand first the difference between denial, and here's a tongue twister for you, another symptom called anosognosia. Anosognosia is not denial. Josh, when he and I have talked about his story, was in denial for a short period of time, or for actually a few years. And once you break through denial, you learn you're ill, you accept treatment, you engage in treatment. About half of the people with schizophrenia, for example, that's 1.5 million Americans, about half of them have the symptom of anosognosia. They don't understand they're ill. So family members need to not do the tough love thing with that person. Instead, they really need to listen to them and work with them to find reasons to go see a psychiatrist, reasons to go get help. It may be, you know, you're really scared, you're worried about this conspiracy against you, you're not sleeping. Maybe you need to talk to somebody and get help for that.
Okay.
Rather than to say to that person, hey, you've got a serious problem.
And
people like Josh, it's different. He has awareness.
Before we leave, Dr. Amador, please let us know, what should we do at the first sign of the symptoms?
Well, the very first sign is to get information if you don't have it. Go to websites like choicesinrecovery.com. Choicesinrecovery.com has a lot of resources so that you can understand how to identify schizophrenia. You can also see a film about recovery from schizophrenia.
Great. Thank you so much, gentlemen. Have a nice day.
Thank you.